in person as I was planning to be. Well, today is August 17th for our City Council special work session. Call into order now. Just a notice to the public, the City Council may vote to go into executive session for legal advice and discussion about the agendized items. I can see Jim here. Councilmember McCarthy, would you lead us in the Pledge of Allegiance, please?
Please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Councilmember. And since I can see Vice Mayor there as well, would you like to say our mission statement, please?
Yes, thank you. The mission of the City of Flagstaff is to protect and enhance the quality of life for all.
Excellent. Ms. Salzberg, roll call, please.
Mayor Deasy.
Here.
Vice Mayor Daggett. Here. Councilmember Aslan.
Good afternoon, everyone. I'm here.
Councilmember McCarthy.
Here.
Councilmember Salas.
Present physically.
Councilmember Shimoni.
Here.
Councilmember Sweet.
Here.
All right, that brings us to agenda item number 4, COVID-19 update and discussion on future council meetings and vaccination incentives. Take it away, Deputy City Manager.
Thank you, Mayor Deasy. Good afternoon, everyone. Shannon Anderson, Deputy City Manager. We have your COVID update for you today. We will start with a review of the recent COVID data. We'll talk about council meeting format with the assistance of City Clerk Stacy Salzberg. I will share with you some vaccination incentives that are going on throughout the U.S., and then we will end today with discussion. Starting off with our number of COVID-19 weekly cases, we continue to see an increase in our number of new COVID cases, 285 with week ending August 7th. This is our 5th week where we continue to see that rise. When you look at our geographic areas, you will see that Flagstaff has the highest number of new cases at 209 for the week of August 7th. Looking at our hospital admissions, those are staying fairly stable, so that is good news. We've seen 16 for the week of August 7th. We are seeing a slight change in the number of individuals or the age of those patients in the weekly chart. Down at the bottom, you'll see where you have under 20 is the dark green, the 20 to 44 age group is the yellow, 45 to 54 is the salmon color, ages 55 to 64 is the light green, and then 65 and older is the blue color. So this is something new that the health department has instituted in their weekly report of hospitalizations. Looking at our number of Coconino County residents who have experienced a COVID-related death, we are seeing 1 for the week of August 7th. The week of 7/31 was also updated from 1 to 2. Just as a reminder, sometimes the reports of death are slightly delayed, and so I will continue to keep you updated as they go back and update previous weeks so you know what those true numbers are. Our community transmission, this chart looks a little different from the last time we presented this data to you in a public meeting. It's been updated by the CDC, and we refer to this as community transmission thresholds. We are looking at the total new cases per 100,000, as well as the percentage of positivity, or the two measures that they're considering in determining what a community's transmission rate is. Coconino County is at high. We've been high for the last couple of weeks. Our percent positivity has decreased to 9% this week. Our incident rate is 201.4, which is an increase from the previous week. and our COVID-like illness of 3.8 is an increase. Our number of vaccinations continue to rise. This weekly report showed that we were at 55.5% of our community has been vaccinated. This is an increase from 54.8% the previous week. We've started looking at variants, given that there's been more and more discussion about breakthroughs, as well as an increase in the variants. When we look at this chart, the ones that are most notable is the Delta variant. We have increased from 27 to 64 in the last week. And also the Gamma, I believe that went from 13 to 19 over the last week. So those are the two variants that we are seeing more common in our community here in Coconino County. The percentage of breakthrough, meaning that somebody who has been vaccinated has tested positive for COVID, has increased to just over 1% with this weekly report. Our hospital census information from Northern Arizona Healthcare for our Flagstaff Medical Center is showing 25 positive patients, which is a slight increase from the week prior, and the number of pending at 1 is consistent with the week prior. So now I'll turn it over to Stacy Salzberg, our city clerk, and she's going to talk about our city council meetings and the format that we're going to use moving forward.
Good evening, Mayor and Council. Stacy Salzberg, City Clerk. Well, for those of you that are here, you can see a lot of the new improvements that we've made in this room. A lot of thanks and gratitude goes to our IT department for the work that they've done. We do have CJ and Paul here to answer any technical questions, but I'll just kind of give you a quick rundown of some of the things that we're hoping to implement as we move forward in this kind of virtual hybrid setting. So today we're experiencing a very excellent example of what a hybrid meeting is going to look like. We've got our mayor and a council member that are attending virtually, and we have some of you here in person, and we're able to interact very effectively between the two platforms there. We also have a new public comment protocol functionality that is going to allow our public to join a virtual public comment room, and they'll be able to provide public comment through that meeting room platform. And so that allows them an opportunity to do things remotely and virtually, as opposed to actually having to come in here physically and provide their comments. As we progress in our reopening, we would obviously have an ability for the public to come in here physically, and then we would also continue with the virtual public comment protocol as well. So again, this hybrid system, supports both an in-person and a virtual attendance for both public, staff, and elected officials. In the virtual, if we were to go back to an all-virtual setting, we can still operate that from this new equipment. Obviously, attendance would be far more remote. It would essentially look like it has looked for the past 18 months or so. So again, slightly different. We just would eliminate that in-person component. Either way, in both the fully virtual or hybrid components, our public participation, we feel, is going to improve. It will, we want to remain as accessible to the public as possible and provide them with every opportunity to interact with you as council members. And so that functionality will remain in both settings, whichever direction you choose to go forward with our future meetings from this point forward. Do you have any questions for me, or perhaps any technical questions that may need some answering?
Councilmember McCarthy?
You'll have to use your microphone, please.
All right, I'm a baby. My only technical comment is I can only see 2/3 of this screen down here. It's if it could be moved to the middle, it would be a lot better. I mean, I can see it if I go like this, but I can't sit in meetings like that the whole, so just a thought.
Thank you for your comment, Councilmember McCarthy. And you're talking about the big screen that's right down here?
Yes, sir.
All right, we can definitely look at what we can do as far as that goes. We can also look at if it would be helpful to swap these, if that's helpful to council. It is possible to swap the displays so that the people are on the outside and the presentations on the inside, whatever your preference would be. So, is that easier? Sounds good. Well, over the next several weeks, we will be taking input. So we encourage you to reach out to me and give us input, and we will be trying to incorporate those comments as best we can into this whole system.
You know, I'm also sensitive to the people on this side need to see everything too. It might make sense to take the two small screens and put them one on top of another.
Okay.
That way you could have everything more towards the center. So, you know, sit here, sit there, and then evaluate it. Thank you.
Appreciate those comments. Any other questions?
Mayor, can I jump in?
Yes, unfortunately on my screen right now, I can only see Vice Mayor and Councilmember McCarthy. So others, please jump in as appropriate.
Okay, no worries. And I did put a C in the chat, by the way, Mayor, just to let you know. But I'll go ahead and jump in. Are we talking about the public in terms of like in-person meetings now? Am I able to ask a question about public in person?
From a process perspective, that's not what we're discussing at this moment. We're just talking about the technology that will allow us to have a hybrid approach both for staff and council as well as for the public. The technology supports, you know, in both directions. I don't know if you want to speak to...
Just as CJ noted, we can accommodate public coming in here physically and participate. They're still able to watch the streaming, so they're able to see the live meeting. They can, depending on council's direction, they can then start coming back into City Hall physically to participate in the meeting. And then they have both a virtual and an in-person option for providing public comment. Does that answer your question?
Kind of. So my question is more along the lines of if council gave directions to allow for in-person engagement. I do have comments and questions about, you know, are we going to allow full capacity? Are we going to space people out? Are we going to block out rows? That kind of thing. So whenever that's appropriate, I'd be happy to bring that up then.
Great. I understand. Thank you so much. And I think that that's part of the discussion that will happen once the presentation is concluded. Yeah.
If I could make one more comment, Mayor, one thing that might help in you seeing a little bit more of the screen is when you're in Teams, if you hover over the picture of all of us, there's three little dots. If you click on those three dots and you click Fit to Frame, it will reframe the image so you'll get the full widescreen image. I did notice that the image is a little more zoomed in than we would like, and it doesn't see some of the screens that we can see here in the room. So we will work with our partner that does all of the streaming to help re-point that camera so that you can see a little bit more of the room as well.
Thank you. Yeah, I actually got that to work now with the wide screen here, so I appreciate it.
Well, thank you, and I'll turn things back over to Ms. Anderson.
Okay, so one more topic on council meetings. We have canceled the August 31st meeting, knowing that some or maybe all of council is planning on attending the league conference. But our hope as part of this conversation is we could confirm who is actually going to be attending, given it's an in-person event. So if we could do that, as well as talk about who might be available to be our city representative at the resolution committee. And then lastly, to discuss who would be willing and able to carry the City of Flagstaff flag in the parade of flags that's part of that league event. So knowing that we've had some changes in COVID, we wanted to be sure that we knew who was going to be attending on the city's behalf and that we could plan who might be able to partake in these special roles.
Thank you, Deputy City Manager. Well, we can just go around and see where everyone's at with the Arizona League. We are getting an emergency alert from my neighborhood again for flash flooding. Please, everyone, be safe. Shelter in place where you're at. And let me just do roll call to make this efficient. I know Saf needs to be able to have time to deal with the current emergencies. So I will go down the list on who will be attending the Arizona League. Vice Mayor Daggett.
I am not.
Councilmember Aslan.
I will be there.
Councilmember McCarthy.
I will not attend.
Councilmember Salas.
I will be attending.
Councilmember Shimoni.
I'll be there.
Councilmember Sweet.
I will be attending.
I will not be attending the event given the current rate and the transmission with even people who are vaccinated. I think that this is potentially a very, very dangerous event, so I will not be in attendance. With that, then we need to see who will be holding the flag and who will be at the resolution committee in my place. So with that, I'm happy to hear if there anybody who would like to elect to be in those positions, please speak up. Who is actually going? And just so you know, too, for the flag ceremony, that part doesn't necessarily need to be an elected official. We could also have city staff do that. I know that Deputy City Manager Shane Dilley is thinking to attend, so we could also have city staff doing that aspect as well. So just happy to hear your suggestions. Or volunteering.
I nominate Deputy City Manager. I'm just kidding. I see Councilmember Salas has a comment.
Mr. Mayor, if I make a
Of course.
comment. Yeah. Just 2 years ago when I attended the league conference, the flag was actually displayed by Louis the Lumberjack, representing Flagstaff and NAU. I'm not sure if NAU will be there, will have an exhibit on site, but that will be a great display of community collaboration and partnership in the city and NAU. And I would volunteer to represent the city for the resolution committee. Keeping in mind, though, that during the conference, Council Member Aslan and Council Member McCarthy and I will be attending a Metro Plan meeting on Wednesday, 10 to 12 of that week. Thank you.
Thank you, Councilmember Salas. And yes, to my understanding, Louis will be there. I see Ms. Langley has her hand up, but I do like the idea of having Louis the Lumberjack representing. So I appreciate that suggestion. Ms. Langley, would you like to jump in here?
Hello, Mayor and Council. Thanks for letting me jump in. I just wanted to confirm that Louis the Lumberjack will indeed be attending. It looks like a lot of the other cities and towns are having either an elected official or a group of elected officials carry the flag. So we could do that and have Louis accompany them, or we could have Louis carry the flag, whatever you prefer. We just wanted to make sure to get council direction on that. So thank you.
Thank you, Ms. Langley. Other members of council?
Mayor, can I jump in?
Of course.
Thank you. Thank you, Councilmember Salas, for those ideas and for volunteering yourself. I fully support you representing us in that committee meeting. And then in terms of the flag, I like that idea, Sarah, a lot. And maybe, you know, the entire group of us that are going can walk with Louis with the flag as a united front representing the city.
I support that.
Yeah, thank you, Councilmember Sweet, as well. I do think that if Louis is carrying the flag, we certainly need our elected officials there representing the city of Flagstaff. I think it would be good to make that a seen partnership. So I'm not particularly, I don't care who necessarily holds the flag, but let's make sure we have mutual representation at that particular part of the event. Any other members of council? I will note that I am not seeing any C's in the chat meetings. As you had mentioned, Councilmember Shimoni, it might be a tech issue on my side. So please feel free to jump in or raise hands and so forth. I am seeing raised hands, which right now I see Ms. Hanson's hand up, so.
Mayor, Vice Mayor, Council members, Heidi Hansen, Economic Vitality Director. I apologize about my camera. Had a lot of rain out here, so I'm having to deal with my technical difficulties. I just want to give some history so that everyone can feel at ease about the Parade of Flags. The reason Louis the Lumberjack has been integrated into the Parade of Flags is because for years we started seeing U of A and ASU's mascots participating. So about 5 years ago, I was able to get Louis the Lumberjack to participate on our behalf. And now the city manager's office handles and arranges that, and Sarah Langley has taken care of that. It is up to you on how many people you want to have carrying that flag. Louis is normally ready to do that, and so whatever you like. And then sometimes Louis is found at the Showcase Your City booth later that evening. Depends on the schedule of whoever is in the costume. But we do have our Discover Flagstaff team, as well as Lowell Observatory, representing your booth that evening at the Showcase Your City as well. So it's a pretty well-oiled machine here, and I just wanted to put everybody's mind at ease that it is very common practice, and NAU definitely knows the drill now. So thank you all, and I appreciate the opportunity to share some history.
Thank you, Director Hansen. Anyone else like to chime in from council on this before we move forward? Unless city staff needs any further direction on this item.
Nothing further on this item. We'll continue with the presentation if that's okay.
Thank you much. Yes.
Thank you. All right. So our next topic is the vaccination incentives. Starting with funding, the American Rescue Plan Act has come out. There has been some guidance from the federal government stating that vaccination incentives are an eligible expense for cash or in-kind incentives. They believe it motivates individuals to get their vaccine earlier than they had intended, and therefore is a betterment to public health. I have provided a couple of examples here in this presentation, and then also have some additional information that was brought up in our reentry team discussion that I will share with you as well. In Louisiana, this example is specific to Shreveport. They identified where their highest number of COVID cases were occurring and set up events in those particular areas of their community. So they were making sure that they were trying to impact the pandemic the best way that they knew how. Those that attended the events at their recreation centers, the first 250 people who attended the event actually received a $100 Visa gift card. And so that's how they worked their incentive there in Shreveport. The next example is in Columbus, Ohio. They actually decided to do a cash incentive because they saw a 30% decline in the number of individuals who were vaccinating within their community. They set up events to identify neighborhoods where they could address the health equity gap. They felt that not all of their ethnic groups in their community were accessing the vaccinations to the same level, and so that's what they were really working on in their incentive program. They did door-to-door education where they went to each of the homes to share about the vaccine as well as to talk about these special events. In addition to just having vaccines available, they also had individuals there to answer questions. They understood that many community members are fearful or have questions about a vaccine, and so they felt to not only have a vaccine event but also an educational opportunity so they could sit down with folks and understand why they might be not wanting to get a vaccine or what their concerns might be around getting a vaccine. So they used this opportunity for that as well. They offered a $100 Visa gift card with the first dose, and they had a verification program where they looked to see if this individual had already received their vaccinations prior to then becoming eligible for that $100 Visa gift card. In 5 weeks, they saw their number of vaccinated individuals increase by 7,000, and 55% of those who attended were, as they quoted, part of their Black and brown community. So accomplished what they were looking to do. New York City had a couple of different things that they tried. It began with in-kind donations, so tickets to events was the example that they used in this particular explanation. Ranged in value from $15 to $50, and they saw a 5% increase in the number of community members that were vaccinated. They also did a contest for prizes that were higher in value, ranging from $250 to $2,500. These were memberships to gyms, memberships to other facilities there within New York City, and they said that it increased a little more than 5% with this additional contest. And then they moved on to a referral bonus program. In this program, they offered $100 to the organization who referred an individual to get a vaccination. They have 600 organizations that are participating in this program and have given out 5,000 referral payments so far, and they have 3,500 that they can still give out to organizations who are continuing to refer folks to get their vaccination. The most recent incentive program that they have implemented came at a time when their mayor had said for you to be able to dine inside a restaurant, you have to show proof of vaccination. So their community was really ready to start getting vaccinated to a higher level than they had been. Again, in New York City, similar to Columbus, the incentive was provided with the first dose. They did verify vaccination status in the state registry. They had 20,000 participants in 1 week. So they started this on a Friday, and by that next Thursday, they had 20,000 more people vaccinated. The gift cards that they were providing, you could get it in one of three ways. It could either be emailed to you, so it was virtual. It could be mailed to your home address, or they had a few pickup locations within the city that folks could stop and get their gift card. And again, this was really in response to New York City requiring vaccinations to basically go out to many of their public facilities, whether it's restaurant, theater, what have you. So I'm going to pause for a moment before I move on to my next slide, because one of the conversations that came up in our reentry team discussion yesterday was keeping in mind that there's been a lot of community members, right? 55.5% of our Coconino County residents who have been vaccinated already. And so if we look to create a vaccination incentive program that's moving forward, doesn't necessarily give them an opportunity to seek rewards for their efforts of getting vaccinated already. There has been the Big Shot program that the county has been promoting. They indicated they have 11 businesses that are participating, but it's really not set up to be able to get a report back as to how many people are really taking advantage of that. And so these next few examples that I'm going to share with you are really opportunities where folks were put into drawings so that there can be, larger prizes for one, and two, it really can include everyone who's been vaccinated, not just those who we are wanting to become vaccinated because they're not currently. And certainly we could consider doing multiple types of rewards similar to what New York City did, maybe something that is specific to those that were vaccinated between such a date and now, and then those who get their vaccination now moving forward. Certainly there are some examples of that. I found the best information on the National Governors Association webpage. They've really done a good job of consolidating what all of the states are doing throughout the United States so that you can see all the various examples. So I have a couple that I'll share with you. But I encourage that if you're looking for other ideas, it's a great source, and I can share that web address with you as well. So in Missouri, they call it their VIP winner. It is their state vaccine program. So this is done at the state level, and they've partnered with their Missouri lottery system. They are doing 180 winners over 5 drawings, and the winners will get $10,000 in cash if you're over 18 years old, or if you're under 18, so between the ages of 12 and 17, they're doing $10,000 towards an education savings account. So students can use it as a scholarship fund to pay for secondary education. They are going to have 900 awardees throughout the program. And they are requiring folks that register online. They're not automatically using that vaccine registration to enroll people. Folks actually have to fill out a registration form to participate in this program. So that's Missouri. Alabama, they've got, again, a couple of different programs. One is a little unique to their area of the U.S. It's at Talladega Speedway. If you are 16 years or older, you actually get the opportunity to drive at the Speedway if you get vaccinated. So very unique, creative, but specific to their area there in Alabama. We also have one that is going to probably resonate with those of you who have young adults that you speak with. It's TikTok. It's a TikTok contest that they've set up for ages 13 to 29. And they select 4 winners for a $250 gift card. So again, what I wanted to be able to demonstrate here is there's a lot of unique opportunities. The awards tend to be specific to the age groups that you're trying to encourage to get vaccinations. California, they did 2 million vaccinated individuals would be able to get a $50 gift card or a $50 grocery card to Kroger or Albertsons. And that is, again, to the first 2 million individuals. They also had examples where folks could win $1.5 million or $50,000. Maybe excessive for what we are looking at as an example here in northern Arizona. But again, I wanted to show you that they're tending to do fewer prizes so that they can be more significant in some of these examples. Again, in Colorado, you saw them partnering with the lottery. They were doing also the scholarships for students who were the age under 18. Louisiana, they did Department of Health. Their state Department of Health did $100,000 each week, and then the grand prize of $1 million at the end of the month. So again, very few prizes, but more significant in size. So those are some of the examples that are on top of what we've talked about here with the ARPA funds that are being done at your state level, at your county level. These that I presented to you today were mostly at the city as well. So with that information, certainly want to talk about what's next steps here for the city of Flagstaff. We are exploring potential partnership with Coconino County. They are also in discussion with their leadership and board of supervisors on their ARPA funds. And so being able to partner with them to utilize ARPA funds of what we have may be available, what they have may be available, could create a more significant incentive program. So the plan at this point is to bring forward the American Rescue Plan discussion to City Council as part of your September 7th council meeting. That way you can look at what are all the potential needs of that funding source so you can determine what amount you'd like to go towards each need. So to end our presentation for today, we'd like to certainly answer any questions that you have, as well as allow council to discuss what you would like to utilize for your city council meeting format, and anything else you'd like to continue to discuss on incentives.
Thank you, Deputy City Manager. I really appreciate all the research that went into this and the different options that you've provided for all of us here. I am very much interested in implementing an incentive program for COVID vaccinations. And I do have a framework in which I would like to see, but I would like to Also, if council has any questions on some of these models or anything of our staff, let's start with that. Councilmember Shimoni.
Thank you, Mayor, and thank you, Deputy City Manager Anderson, for that presentation. I'm open to this as well, Mayor and Council, and my question is, can we get more information about those who are vaccinated versus those who haven't been vaccinated yet? Ages, any information we can get to better understand who is our target market so we can best target them.
Thank you, Councilmember Shimoni. Deputy City Manager Anderson, do we have that information handy, or what would it take to get that info?
Mayor DC, it's not something I have readily available with me today, but certainly can look into that and come back with maybe some age groups, maybe populations, area within the community, whatever angle that we can look at, because I think as we've seen at the examples, the more creative we can get with our incentive program, the more effective they can be.
Thank you. Yeah, and I did look at the, I don't have the information at the local level, but in my research into these programs and their efficacy and the who needs to be targeted on more of a national and state level, it is showing it's, and through the surveys that are happening, really the demographic that is willing to get the vaccine but has not gotten it yet tend to be the working class. It's the individuals in the surveys who are saying, well, yes, I'd be willing to get it, but I work 6-7 days a week, and if I get side effects for a day, I can't take a day off of work. So providing, for example, a $100 incentive for individuals to get the vaccine with the stipulation that, for example, you could not receive it if you are making over $45,000 a year, $50,000, whatever it may be, would help us target the working class individuals that may be incentivized by this type of program, and in addition, provide $100 to the individuals that could really use it the most in our community. So, and then on top of that, Hispanics and Blacks are the demographic that have the lowest rate of it. So having something to that effect, that the Ohio model where you're going door to door and having a pop-up clinic simultaneously, you can refer them to in some of our lower income neighborhoods, our CDBG neighborhoods may be a good way to target some of these incentives. So just throwing it out there in terms of the bit of research I've found on the academic side. Other council members, any questions for Deputy City Manager? Councilmember McCarthy.
Thank you. My first question is, and I think you're going to present this, Shannon, at a future meeting, would be what the other things we could do with this money are. Because, and then the other thing is, we're talking about fairly trivial incentives for encouraging people to get the vaccine, $50 or whatever. The most obvious incentive for getting vaccinated is that it will probably dramatically reduce the fact that you could die. And if that doesn't motivate people, I don't know how $50 is going to motivate people. I'm not saying how I'm going to come down on this in the end, but that's a thought that goes through my head. I also realize that some of the data shows that it does encourage people to go get the vaccine. So that has value, but the major incentive is it could save your life. Thank you.
Thank you, Councilmember McCarthy. Vice Mayor.
Thank you. Great discussion. I look forward to continuing to have the discussion. If it was suggested that somehow we do some kind of income qualification, I think without knowing more about that, I'm initially uncomfortable with getting into people's financial information. But as I said, I look forward to continued conversation about this.
Thank you, Vice Mayor. Other members of council? Councilmember Aslan.
My question is about age. So does this go all the way down to 12-year-olds who are just getting their first vaccine once their birthday comes around? Obviously, they're probably not making $45,000 a year. But so just wondering where that plays into this, and wanted to echo the discomfort that the Vice Mayor was mentioning. Although I will say that I do fully support any incentives that we can come up with, and I don't think that they need to be retroactive either. They can be. I'm not saying that they can't, but I believe that if we're going to focus on just the people who haven't gotten vaccinated yet, that's great. The incentive that worked for those who are already vaccinated is a much reduced risk of catastrophic illness, and a nice pat on the back and warm fuzzy for voluntarily and responsibly participating in our public health. But to get that, we've said this before, it's all about the asymptote. If we could do whatever we can to focus on those who haven't been vaccinated, I'd rather see those resources go towards the people that still need to cross the finish line.
Thank you, Councilmember. Yeah, and I understand the trepidations about the income requirements. Really what this is, the reasoning for that is to be able to have better targeting with the incentives towards the demographics that's still willing to get vaccinated but have not due to economic reasons, because that tends to be the reason that in surveys and so forth that is showing the delay for some that may otherwise get them, and to offset, for example, their day that they'd be doing DoorDash or Instacart or something to that effect to cover their economic well-being that they are concerned about.
Well, how do we sort the 12-year-old out of that equation?
Well, to be honest, I think that it should be, with that part of the equation, it should be adults only. I mean, then we're walking into a real mess with parental rights. If it's the mom, if it's the dad, they're separated, then that gets real messy. And so again, this is
parameters.
Well, this is something that we have a lot of options on the table. So like a TikTok challenge kind of thing or whatnot could help us address that demographic, but a straight cash payout to individuals under 18, I think I mean, maybe Sterling could jump in here. I think that's going to get a little messy.
Yeah, Mayor, Council, that'd be something I'd be happy to look into. Definitely have some concerns and questions myself with that.
Thank you. Other members of council. Councilmember Shimoni.
Thank you. I'll be quick. So the other couple ideas I had was I think we can do some more video outreach efforts and ideally multilingual video outreach to empower the community to see the value in this, address some of the misunderstandings, and just do some more promotional work on our end to empower the community. I think that I like the idea of partnership with larger entities in town, whether that's FUSD or NAU, CCC, the hospital, GORE, our big partners I think we can collaborate with in this outreach plan. And then in terms of incentives, if we can maybe reach out to the Chamber and the DBA and any other agencies that work with local businesses to see what kind of donations we can receive for gift certificates or whatever it is that we can do to, really put together a quality raffle or just giveaway program. That would be of interest to me. And then I definitely just wanted to express interest in partnering with the county and seeing what they have, what they come up with, and seeing how we can, team up in this effort. Thank you, Mayor.
Thank you. And yeah, if anyone could reach out to the Chamber and DBA, I reached out to them 6 months ago with this idea, but they were not interested at that time. maybe things have changed, but yeah, I think that if we can partner with some of our business community for, at that time, I was thinking like a coupon card, kind of like Kinsey Elementary when I bought that back in the day for 10% off of this business or that. It might be a good incentive and goodwill from our larger business community. So I would be interested in, yeah, seeing if we can pursue that as well. But as it comes down to some of the research on COVID incentives, I will tell you that the lottery system has not shown as effective as the straight payments. When we're kind of utilizing people's sense to gamble as opposed to their sense of economic need, then it is a less efficacious model in trying to ensure that they're getting vaccinated. And this is just some of the more recent data that is coming out of some of these programs. That's why, and again, I respect the trepidation around the income thresholds, but that is more of a targeting mechanism. But I'm more interested in a straight payment for getting vaccinations, and in particular, the Ohio type of model that was presented by Deputy City Manager Anderson, that was direct payments that can be made with pop-up clinics in neighborhoods that maybe have less vaccination rates and maybe more economically disenfranchised, maybe rather than a income threshold. That's the kind of incentive program we establish. We can go door to door, knock on it, say, hey, this Saturday at 6 p.m., when you're less likely to be in the middle of work, we are setting up this program and you can receive $100 for your first COVID vaccine. So that's kind of my thought on the option that I think is going to be the most effective based on my limited research into this incentive programs that are out there. And I'd like to hear what you might think about that model instead, rather than income thresholds or whatnot. Councilmember Sweet.
Thank you, Mayor. Let's see, I'm definitely up for looking into this more. I like the public outreach aspect. I think that will be huge if we can go door to door and do some outreach that way. And in regards to the Big Shot program that is already happening with the county, my business has participated. I have a rather sizable discount for those getting vaccinated, and I can tell you I have not had a lot of luck with that. So I'm just suggesting that whatever we do, we need to get creative with our outreach and make sure that the program is well received in the community and out there, because it's just very hard to get the word out on the program. So those are my comments. Thank you.
Thank you. And I do also think we should be doing dedicating resources to outreach. To be honest, I don't think videography is going to be that efficient in doing so. What I would honestly like to see is we got a lot of street poles around town, and be able to put up banners and so forth for wear your mask up, or COVID vaccination on site this day, something to that effect. I think would be more effective than a videography on social media that people won't really watch that much. Councilmember Shimoni?
Sure. Thank you, Mayor. A couple things. I thought also maybe a couple town halls in different parts of town might be effective in terms of answering questions. And, I think more than the incentive is going to be the empowering and overcoming of the individual's concerns and fears and understandings about the vaccine and the impact on their bodies. And I guess that was the intent with the video, is to help address that as like a shotgun approach. But yeah, I agree with you, Mayor. It's not going to be the thing that addresses it at its core for everybody, but I still see I still see value in the video idea for sure. But that was one idea, was this town hall thing, maybe a couple town halls around town that we also broadcast through social media and whatnot. But the other comment I had, Mayor, was in regards to NAU, with NAUs opening up for the fall semester. You know, a lot of these students are coming from out of town where getting tested and getting a vaccine might have been a headache and very difficult. You know, here in Coconino County, it's actually very efficient and easy and affordable. And so I wonder what we can do with NAU to really target that student population, since we know that they are going to at times be the ones helping to transmit this virus in our community in not a positive way. So just a thought and a question at the same time is how can we better partner with NAU, and what is NAU doing to help with this? Thank you.
Yeah, and I can help answer that a little bit. So the NAU set up a raffle for all kinds of prizes, from signed Suns t-shirts to iPads. And thus far, there's been 5,000 students within only a couple weeks that have uploaded their vaccine cards to show that they're vaccinated, and prizes are already rolling out, and that's even before the semester begins. So what NAU is doing for that kind of raffle type program seems to be working towards its intent. I was very shocked with how many had already uploaded to participate in that for all of these prizes, which also speaks to some more of that. Some of these incentives really do lead to some behavioral changes. So I just wanted to mention that in terms of what they are doing with their incentives. Other members of council? Councilmember Salas.
Thank you, Mr. Mayor. First, I want to lend a voice to a portion of our population who have not been vaccinated due to existing medical conditions. I just want to recognize those residents. I have them in my family in the Philippines who were not able to get the vaccine per their doctor's recommendation not to get the vaccine yet. Second point, I do believe that fully vaccinated residents are the biggest advocate to their families, their neighbors, their co-workers get vaccinated. So I'm in support of some kind of an incentive to those who are really, fully vaccinated, whether it's some kind of a raffle, with, depending on cost too. I'm looking forward to further discussion with the county to strengthen partnership with pop-up clinics, and just thinking out loud, with those pop-up clinics and also targeted neighborhoods, perhaps there will be some goodie bags. When they get a vaccine, they receive goodie bags filled with valuable items that can be used at home and in the household. And I also want to look into the potential for incentivizing organizations for referrals. And I think that was in the New York model, Ms. Anderson. I want to look into that possible option. And let's keep our thinking creative hats on and get the word out about vaccination. Thank you.
Thank you, Councilmember Salas. Well, with that, I am hearing that a majority of council interested in pursuing a COVID incentive program of some sort, whatever that shapes up to be. Um, and I definitely agree that we need to do this in coordination with the county, especially considering they're the ones who are running the vaccines, not us. Makes sense. I think for the sake of this work session and the direction for city staff that we can pursue joint ventures in this regard. Personally, what I'm seeing in the research and is that direct payments of cash, not prizes and these kinds of things, is the largest incentive. So I am going to be pushing for, in terms of those incentives, just a straight $100 Visa gift card that we can give to residents who get COVID vaccines at particularly a pop-up locations, events, and we can go door to door to let them know and get them over there to get vaccinated, and they make $100 if they walk a few blocks down the street to get their vaccine, kind of situation. I think that would be the most efficacious use of our resources to see that through. But again, I am open to all of the options available with this, and I would like to see us, given that we are, the numbers are still being tallied for us on how much of the ARPA funds that are available. But I do think absolutely, given that ARPA is for addressing the COVID issues that we've been facing, that it only makes sense that we prioritize this kind of thing on the list of available resources as opposed to other potential pet projects and so forth. This is directly addressing the needs of regarding COVID. With that, though, I also want to touch base on, Councilmember Salas. I'll let you jump in here.
Thank you, Mr. Mayor. If I may recommend to look into the potential legal issue that will be put forth by giving out cash incentives, see if it runs counter to the city's gifting policy.
Actually, I can answer that. These are ARPA funds we're considering here as a council. I believe that's something that needs to be clear, and I was going to end the discussion here today to make sure it's clear for everyone. It's the America Rescue Plan Act funds only that would be used for these incentives, no other city funds.
Thank you, City Attorney. Well, with that, I think we have some direction when it comes to the incentives. The other question really comes down to is the marketing aspect of this, whether we want to engage in that or not. Personally, I think we need to be putting up banners downtown saying not saying mask required, not saying mask suggested, it just says mask up in Flagstaff, and have those on signs, or to promote vaccinations as well. Would this be something that you all would consider doing? Because inevitably, time is the essence here, Council. I mean, we can wait and go for September 7th and then a second vote, and in 6 weeks, maybe we will have something possibly done. Right now, we have the ability to accomplish something, and I would really like if we could get the ball rolling on one of those things. And if we can get the marketing aspect of this and dedicating resources, that would be great. So I'd love to hear from you. Councilmember Shimoni.
Thank you, Mayor. I am all in favor of marketing, whether it's video, social media, or banners, or however so. I am supportive of that.
Thank you, Councilmember Shimoni. Vice Mayor.
I am also completely in support of that, including if we want to get an effort going door to door, anything along those lines, I'm fully in support of.
Thank you, Vice Mayor. Councilmember Sweet.
Thank you. I'm definitely in support. And what I found worked the first time around were the signs given to all the businesses. We put them on our windows and doors, and we had a cohesive message. And I thought that that really was helpful, so that the customers kind of saw it everywhere they went, the same message. Thank you.
Thank you, Councilmember Sweet. Councilmember Aslan, and then Councilmember McCarthy.
Yes, just wanted to clarify. I'm in support of these outreach efforts. I'm also in support of the $100 incentive for those 18 and older who are just getting their first vaccine.
Thank you, Councilmember. Councilmember McCarthy?
I don't have a firm position yet because I think we're getting the cart before the horse. As I said before, I think we need to have a discussion about what the alternate uses of these monies might be. In the end, I'll probably support this, but I think we should at least go through a discussion of what the alternatives are before we make a commitment. In effect, we would be outruling other uses of that money that might be also important. Assuming we do this, I think communication should be a very important part of it. And just having a sign, please mask up, that'll accomplish nothing. If we can have a program where maybe go to door or talk to people at events or whatever and have conversations about them in such a way that we respect their concerns. Some people are scared of the vaccine. And maybe if we can professionally have professionals or information from professionals that address that, I think that will be way more effective than just like, please mask up. My other last comment is that whatever we do, let's keep it simple. We don't want this to turn into an administrative nightmare. So getting into how much money people make and this, that, and the other thing, no. Just keep it simple. I mean, if it's give them a $50 gift certificate, boom, do it. Keep it simple. Thank you.
Thank you, Councilmember McCarthy. Councilmember Aslan, I see your hand up. Was that just a relic of the prior hand up?
It's a relic.
All right. Councilmember Shimoni.
Thank you, Mayor. Quick follow-up. Whatever kind of marketing we do, I think it'd be important that there'd be QR codes integrated into the banners or whatever it is to take people to more information on a website that talks about vaccination opportunities, testing, some of the top questions asked, et cetera, et cetera. And then my other comment was, along the lines of thought of the door-to-door topic, a week from tomorrow, we are doing a community welcoming event in partnership with NAU, walking door to door with a bunch of other folks, including the president of NAU. And I'm just wondering if we can somehow team up with that effort to do some kind of promotion, since we are, trying to keep it simple and clean. That's a door-to-door effort with a lot of human power behind it. So just a thought. I know that's in a week from now, so that might just be barely enough time to pull something off.
Thank you, Councilmember Shimoni. All right. Well, with that, I think we do have a majority of council wanting to utilize some resources from some pot on marketing for both masks and vaccines, and that we are looking for a potential incentive program of some sort. And it does seem that some door-to-door and a cash-in type incentive seems to be on the list of possibilities there. So, city staff, do you need further direction on these items?
Not on those items, Mayor. The last piece we'd have to discuss is the type of format that City Council would like to see your meetings moving forward.
Thank you, Deputy City Manager. Council, we'll hear you on that front. Councilmember Shimoni?
I'll get us started. I'm comfortable with in-person. I'd like to see us maybe put a lesser capacity on the chamber itself. I'd also like to see us maybe section off rows for seating versus non-seating rows, so that we try to do our best to maintain social distancing in the chambers amongst our public, and asking, maybe having clear signage at the front, at the entrances saying, hey, please social distance, and also having sanitation everywhere possible that we can, just to really, keep it as safe as we can. And then I like the hybrid approach where if council members or the public don't feel comfortable, they can tune in virtually. But I think it's time that we allow the public to come in person. That's my thought. Thank you, Mayor.
Thank you, Councilmember Shimoni. Councilmember Aslan, and then McCarthy.
I had a question earlier. This is the appropriate time for it. Can someone come up and talk to us about the ventilation in council chambers? Is there negative pressure going through the building? How well ventilated is that space? Thank you.
Councilmember Aslan, I know Scott Overton and Andy Bertelson are actually dealing with the flooding that's going on in the community, so they are not here today. Could we get back to you with an answer to that ventilation question? We can send that out to you as the rest of council.
Sure, but I'm not really feeling like I'm in a position to authoritatively weigh in on this topic until I know the specifics of that.
Understood.
I think it's a critical element to consider as part of the conversation. I think being indoors with a mask on is a safe way to effectively reduce risk, especially knowing that all of us are vaccinated, at least those of us in the front of the room. I'm assuming there's no way that we can confirm vaccination status for the public coming and going, and that's why I think the ventilation issue is critical, especially given how long our council meetings can get. This is about the viral loading and the rate and the time frame and the ventilation of the building we're in and the overall volume are critical components of that conversation.
Thank you, Councilmember Aslan. Councilmember McCarthy.
I'll pass for now.
Vice Mayor?
Thank you, Mayor. I'm okay with the hybrid. I like the idea of social distancing, definitely masking up. My main concerns are, the children of staff, the children of council members who are so young that they can't be vaccinated. And so I'm really concerned about making staff be in here, as well as the public. But if we can figure out a way to do it in a safe manner, I'm all for coming back in person masked.
Thank you, Vice Mayor. Others? Councilmember Sweet.
Thank you. I have been looking forward to coming back in person and would be okay with the hybrid model, and definitely, ensuring that everyone in here is masked, and what Councilmember Shimoni mentioned with the seating. I think it's of importance that we do row by row or somehow make sure that they are social distance inside the building. Thank you.
Thank you, Councilmember Sweet. I would, echo that front, that with having this hybrid model and having folks coming in person, blocking off the rows or every other seat or whatnot, that will make sure that we are following CDC guidelines for those who are unvaccinated. With that assumption, let's follow the CDC guidelines for the crowd on that front, which would be the masking and then the distance between seats. So that's where I would like to see us. Councilmember Salas.
Thank you, Mr. Mayor. I would support a hybrid model for public participation, implementing physical distancing. I also want to take it to another level at the entrance for public participants to come in, have a temperature check, and also fill up questionnaires, like when I go to a doctor's clinic, or even for a check-in, is those template questions about symptoms, coughing, temperature, traveling in the last 14 days before they enter the chambers.
Thank you. Councilmember McCarthy.
It sounds like we have a consensus. I agree with what I've heard from the other council members.
Thank you, Councilmember McCarthy. I am concerned with doing some type of fill-out survey. Councilmember Salas, what would we do with that information if, for example, they have been traveling in the last 14 days and are having symptoms? Are they not allowed in the room? Or how do you foresee us enforcing that and making sure they're removed from the building? And I would have questions with the city attorney regarding how that might play out in the end.
Mayor and council, that would be something I'd like to look into. If the council wanted to go that direction, I would look further into it. But I've heard it from one member of council here tonight only.
Councilmember Shimoni.
Thank you, Mayor, and thank you, Councilmember Salas. I like the idea of temperature taking and maybe just a couple questions about, have you been experiencing symptoms? Have you been exposed? Do you have COVID currently? And if we can, require folks to pass that questionnaire, maybe not in a written format, but just in a verbal format. I've seen that and experienced that myself in a number of entrances that I've tried to go into. And personally, I feel comfortable with that. I'd be curious what our legal staff comes up with, doing a little bit of research. But if we're the only two council members that feel that way, then that's fine too. Thank you.
Councilmember Aslan?
Yeah, I actually like the idea of a temperature check. I don't know that we need to do anything in addition to just actually being there to check their temperature. If someone is walking in there, they got a fever of 103, I think just a pretty stern look will probably turn the person around. I mean, I don't know that we need to get into the details of how to enforce or monitor that other than just simply doing it. I think it creates a nice filter for us that would improve public safety.
Councilmember McCarthy.
I also would support the idea of a temperature check, and it should be that if your temperature is over X, ask the professionals to fill in the blank on what X equals. They can't come in.
Okay, I think that specifically, if I would be interested in specifically that from city attorney, if you can investigate for if somebody has over 100.4, which is technically when a fever is, or et cetera. Let's just check that specific. I would be interested in checking that specifically for any legal concerns above and beyond just a temperature check. I think it might be administratively a little difficult in how it actually gets played out. So I would be interested in looking at that specifically. Councilmember Shimoni.
Thank you, Mayor. Quick follow-up. Maybe we can just have signage at the front that says if you've experienced COVID or, are feeling symptoms of sickness, please, I don't know how to best phrase this, but something that deters people from coming in if they currently have COVID and they're consciously aware of that. I've seen people do that at times, say, oh, I have COVID right now and I'm going out and about tonight and no big deal, and I don't want to encourage that here. And so maybe just a sign is what we do if we decide to do that at all. But I like that we're moving forward at least with the temperature component. Thank you, Mayor.
Thank you, Councilmember Shimoni. City Attorney?
I was going to defer to the Deputy City Manager, Shannon, first.
Thank you, Sterling. Councilmember Shimoni, I wanted to let you know we do have that signage in front of our building before folks come in, reminding them of what those symptoms are and not to enter if they're experiencing those.
So I like this physical hand raising. I feel like school just started for us here. But what I've heard is direction to look into the temperature check, not the verbal questions or the written questions, correct? Okay, just wanted to confirm. Thank you.
All right, any further direction needed for city staff at this time, or have we covered all the boxes? City Manager.
Thank you, Mayor. We have a retreat coming up on September 30th. Please check your calendars on that because we changed the date from the previously scheduled date. So September 30th is the date that has been affirmed. I would like to get a read from council as to how that retreat should be conducted: in person, virtual, hybrid. That will, and we do not have a venue established yet, but I think council's decision will inform our decision as to the venue, preferably outside of council chambers, but we'll do what we can. But if we can have some discussion on that, it will be an all-day retreat. In typical fashion, the format will be inclusive and with dialogue. So it's a little bit less formal than this type of meeting with more free-flowing communications. Thank you.
Councilmember McCarthy.
Thank you, Mayor, and thank you, Greg. I would support an in-person meeting, but I'll also say if one or two council members wanted to be virtual, we should respect that. But I would come in person the way I see it tonight anyway, I would, depending on how the world changes. It changes from week to week, as we know.
Yep.
Thank you, Mayor.
Thank you. Councilmember Sweet.
Thank you. The world is changing awfully quick, but as of tonight, I would echo what Councilmember McCarthy stated. Thank you.
Thank you, Councilmember Sweet. Councilmember Aslan, did you have is that a new hand raised?
Is my hand up again?
Jeez.
Well, I'm happy to weigh in. Yeah, just for the record, I am totally amenable to us meeting in person, and the reason I'm not there right now is not made to be meant to be a statement of not being willing to meet with all of you in person. I do appreciate the hybrid flexibility that we have right now. I do have a child who is not 12 and not old enough to get vaccinated, and given the CDC's recent new revelations about transmissibility, even amongst the vaccinated, those concerns will remain with my family until my son is 12 years old, which is not too far away. But I'm very much willing to do our staff retreat in person. Again, I think it's important that we're in a space that has negative pressure and is well ventilated. And we should all be cognizant too of recent things that we've done that might be of higher risk, and make sure that we're well and that we don't put each other at risk by showing up when we're not when we're feeling under the weather. And just the presence of this hybrid availability really makes that flexibility available. I'm repeating my words here, but do appreciate that and look forward to seeing you all on September 30th, and certainly sooner than that as well.
Thank you, Councilmember. And with that, I guess the question, because everyone is willing to be in person in this situation, I guess Councilmember Aslan raised one concern is if any of us is facing symptoms that they would stay out of the budget session. Is it possible we can have that session as a hybrid model as well, not just strictly in person? Just in case one of us falls ill, because this is going to be a very important discussion for us all to be involved in, and I don't want anyone feeling pressured if they're they got a cough and a sneeze going on.
I'll jump in, Mayor. Thank you. You know, the improvements that we're being a part of this evening in terms of the technology are present here in the chambers and in the council conference room, and will soon be present in the staff conference room. And I think these types of improvements will make their way throughout the facilities over time. I don't think we'll have this same level of technology in a different venue, but I do believe there may be ways that we can orchestrate it for some to attend remotely, if that's the direction. And we may want to have that as a backup anyway, because I would agree with the comment made. It's a rapidly changing set of circumstances out here. What we agree with today may quickly change in a few weeks. That has been the theme throughout the pandemic, is a rapidly changing landscape. So we do need to be adaptive, I believe. I will work with our technology team and staff to see what arrangements could be made to allow for remote attendance at whatever venue we come up with.
Excellent. Well, I do believe we have formed consensus on the budget retreat as well. So anything else for city manager or deputy city manager?
Thank you, Mayor DC. One last question was when we would like to unlock the doors to allow entry for the potential temperature checks, as well as identifying where folks can sit here in the chambers. Do we think 30 minutes is appropriate for that? Or do we have other thoughts? Seeing some head nods, 30 minutes.
I'm comfortable with that, the 30-minute mark.
Okay, thank you.
Before council, starts up.
Thank you.
City manager.
Thanks. Related, I would like to circle back to the discussion about staff's role in these meetings and our protocol. For the benefit of you, Mayor, and the council, I think we've heard from our staff on this that there is a desire to be flexible as to whether to attend in person or remotely. And I think council can expect that if there are presentations, there's always presentations, but those involved in the presentations will likely be here in person if it's warranted. And those who are not presenting will continue to attend, but will do so remotely. Right now in the council chambers, we probably have 9 or 10 staff people. The room is largely empty. I don't know that will be symbolic of what lies ahead. Of course, today we had a very significant flooding event, and a lot of the staff are out there in the community addressing that. But moving forward, I think what you can expect from staff is some in-person attendance when presenting, and a lot of virtual attendance by others, and certainly they would be available to answer questions or weigh into the discussion. With the city manager's office, I think you can expect to see continued presence by all of us, or most of us, at these meetings in person. I'll let our legal counsel speak for himself, but I think what you're witnessing tonight could be a little bit representative of what is to come in the future. Thank you.
Thank you, City Manager. Councilmember McCarthy.
Thank you, Mayor. I think your suggestion, City Manager, is excellent, that we could accommodate a hybrid model for staff and, use your judgment. Let staff use their judgment. I did have a related question in that the times of meetings that we've done for the last 18 months is different than the times of meetings we did before that. So we might want to have a discussion about what time the meetings are. Maybe Stacy, our city clerk, could come to the mic. Here she comes.
Sorry, Mayor. I realized that you couldn't see me in the corner there raising my hand. May I go ahead and answer that question?
Thank you.
Thanks. So we actually have that exact conversation slated for our next council meeting next week. So I'll be presenting to you, kind of talking a little bit about how we move forward with either changing times in our rules of procedure, and then I'll also be addressing the kind of the suspension of the rules that we're currently operating on. So we will have that discussion next week.
You expect me to wait a whole week for that? Okay. No, actually, that's great. Thank you.
Thank you.
Excellent. Anything further before we adjourn here?
Is this to and from right now, or?
Oh, let me look that up. I think yes. One sec. So long as staff has everything and any questions of council has been addressed regarding the COVID update. And I'm not seeing anything further on that. So yes, we are down to the informational items, 2 from mayor, council, and city manager. And happy to go down the list here. Let's go in reverse order and start with Councilmember Sweet.
Thank you, Mayor. It is great to be back. Had a wonderful time off, but it's good to see everyone. I did attend the BPAC commission, and the artists were chosen with the proposed artwork for the utility box wraps, and that was pretty exciting. A few of my friends made it onto that list. And I'm looking forward to continuing on with my Mountain Line meeting tomorrow and the Water Commission on Thursday. It'll be great to get back into the swing of things. Thank you.
Councilmember Sweet. Councilmember Shimoni.
Thank you, Mayor. It's good to be back. It's been a nice summer break, a little too short, I think we all would agree, but it's really good to see everybody's faces, especially here in person, and I really look forward to this upcoming year. I just want to express gratitude to leadership for their hard work throughout the summer and in partnership with the county and our other partners, specifically around the flooding and the fires. It's been hectic. I know that all of us here know about that effort, but to staff, thank you. I do have a couple fairs I want to go ahead and throw in the pipeline, one of which is going to be a conversation regarding Eugene's efforts to house their unsheltered populations through the Square One Villages approach. I'll talk more about that later. And then the second fair is kind of similar to what's coming in the weeks to come, I think next week to be specific. And that's a fair request to have a conversation about the Eugene's efforts through their temporary urban camping. And that is in, I think, a few different sections. One is in parks, one is along streets/public property, one is on private property, and one is in cars. This is all found on the Eugene website. I can send links to leadership, but I think these are great efforts that I love to see Flagstaff learn from and take on in our own way. Great to be back. And then just in closing, Mayor, I just wanted to mention that as a vaccinated individual who could be asymptomatic, I plan to set up a regular testing routine. And I know that the field house, I believe, is going back to the public with testing opportunity that is free as of tomorrow. So with the students coming back and the field house being open, I just encourage everybody to get tested regularly, come up with a plan, and integrate that into your schedule, because as a vaccinated person, we might not see the same symptoms, but yet might be helping spread the virus. So let's each do our part. And thank you, Mayor, and thank you, staff, and thank you, Council. I'm looking forward to a really good year.
Thank you, Councilmember Shimoni. Councilmember Salas.
Thank you, Mr. Mayor. Last August 2nd to the 4th, I had the honor of attending the Governor's Conference of Tourism, being the council liaison to the Tourism Commission. We had our tourism chair, Terry Madexa, attended the conference as well, along with our Discover Flagstaff team. Our city received 2 awards. The only city who received 2 awards on programs. The first was the community partnership in a rural community, which acknowledges the effort of the partnership between the Discover Flagstaff, City of Flagstaff, and Flagstaff Trails Initiative on the Pledge for the Wild program. As you know, Pledge of the Wild is a national movement. There are only 5 cities currently in that program. The second award was given to Canyon Diablo Distillery, who pivoted and transformed the distillery into manufacturing hand sanitizers and distributed it to our brothers and sisters in the reservation. So thank you to our partners with the Flagstaff Trails Initiative and Canyon Diablo Distillery. I had the opportunity to do a quick tour of the newly opened Tinkertopia facility last week, and I signed up to volunteer one of these days. Congratulations to Dr. Alice Christie for that effort, and also kudos to our staff for working with Tinkertopia in transforming that facility, which is perfectly situated to provide STEAM education to from zero to all ages, but specific to the youth of the neighborhood in the area. And then last Thursday, I had the opportunity to witness the awarding of grants to nonprofits who submitted grant applications to the newly named Creative Flagstaff, formerly Flagstaff Arts Council. And last but not the least, a quick announcement. This Friday is Arbor Day. If you have time and are able, please volunteer. Friday, August 20 to the 6 p.m. Adopt a tree, clean up, plant native trees on Macmillan Mesa. So I think it's available at our city Parks and Open Space website and Facebook page. Thank you.
Thank you, Councilmember. Councilmember McCarthy.
Thank you, Mayor. I enjoyed our time off this summer, but I'm kind of amazed at how busy I actually was, having a lot of meetings and things. So things march on, but it's good to be back, and it's good to see people in person. Just a quick comment about Mr. Shimone's second fair item. I think that ties in rather closely to a fair or a citizen petition that we're going to be discussing next week. So coordinate that somehow. Anyway, thank you, and see you next week.
Thank you, Councilmember. Councilmember Aslan.
Nothing, thank you.
Thank you. Vice Mayor.
Thank you, Mayor. I have a couple of things. One is that housing staff and all the volunteers that have been working on the housing plan are getting ready to take a draft out to the public in October, and the dates are just getting set now, but I want the public to be prepared to weigh in on that and give your thoughts about the draft plan. And the second thing is that this Thursday, the Flagstaff Sustainability Program has their event on the IPCC report, Climate Change and Action. And that's the Intergovernmental Panel on Climate Change. And it starts at 6, and it's via Zoom. And all of that information can be found on the city's website or on any of the various Facebook pages for the different departments. But I'd like to echo the kudos to city and county staff for all the work on with the flooding issues. I know a lot of us were out there going door to door, and staff just did a fantastic job keeping people apprised of what's going on and giving us things to do. So thank you.
Thank you, Vice Mayor. I'll save my to and froms for next week. I know our staff really needs to get to the current flooding emergencies going on. So I do think that Sterling, our city manager, do you have anything for us? Or city attorney also, I think, had wanted to chime in here briefly.
Thank you, Mayor. I had promised a city manager's report sometime during this recess. That report will be coming out this week. It has grown in volume. It will include a number of monthly reports appended to it, some work anniversaries, which we like to celebrate, organizational updates, and so forth. Keep an eye out for this week's report, and I'm sorry that it did not get to you sooner, but it will be timely in terms of all the topics that it's covering. Thank you.
Thank you, City Manager. City Attorney.
Thank you, Mayor. It's not very common that I ask for a moment during the informational section, but there are two things that I just wanted to highlight. I think one of them you're already aware of. Senior Assistant City Attorney Christina Rubalcava's initiative and efforts with respect to Flagstaff Village and obtaining an extension, if you will, for or working with their legal counsel to obtain an extension for those who are there and will be moving on. So I really wanted to recognize Christina for her work there. And Councilmember Salas, you already mentioned Tinkertopia. Deputy City Attorney Kevin Finsel played a very key role in making that happen for Tinkertopia in the city, and I wanted to recognize him for that. Thank you.
Thank you, City Attorney. With that, our meeting is adjourned. Thank you all.